Good afternoon, and welcome to the 2020 VHHA Lunch and Learn webinar series. This webinar series will focus on quality, patient safety, and high reliability in healthcare facilities around Virginia. My name is Christy Burnett, and I'm the Director of Patient Safety and Quality in the VHHA Center for Healthcare Excellence. I'm your moderator for today's presentation. Before we get started, there's a few housekeeping items I'd like to share with you. This webinar is being recorded. All participants are muted. Questions and comments can be addressed at the end of the presentation, but feel free to enter them in the question box anytime during the presentation. There'll be a short feedback survey at the completion of the webinar. Your responses to that would be greatly appreciated. I've got the slides in the handout section of the control panel on the webinar and a one-time registration for this webinar and the rest of the series, so no more registering is needed. Now I would like to take a minute to introduce our presenters for today. Alicia Fink is a performance improvement consultant at Children's National Hospital. She is a nurse by background, teaches quality improvement, and leads multidisciplinary teams working to reduce harm for patients, families, and staff. Raven McLeese is the nursing safety coordinator at Children's National Hospital. She is a pediatric nurse by background, and in her current role, she leads multiple initiatives related to ensuring the safety of patients, families, and staff. She also tracks and trends safety indicator data, which is used to maintain awareness and support quality improvement initiatives. Welcome, Alicia and Raven, and the floor is now yours.
All right, thank you for that introduction. So again, my name is Raven McLeese, and we'll be talking to you guys today about our journey to improving employee safety. Next slide.
My name's Alicia Fink, and I'm also very excited to be here with all of you to discuss this awesome project. Thanks.
All right, so before we get into our journey, we want to give you a bit of a background about Children's National. So we are a freestanding 323-bed acute care pediatric hospital with over 900 physicians, 1,700 nurses, 2 pediatric ERs, a critical care transport team, and multiple regional outpatient centers and an ambulatory surgery center. Next slide, please. So essentially, we often in healthcare focus on the safety of our patients and families. And what we noticed is that obviously our staff are being injured as well. If we look at injuries by industry from 2016, we see that healthcare is one of the industries where staff are injured the most. And this is more than manufacturing or construction, other areas where we would think that there are more staff injuries. So this is a focus and reason why we decided to take this journey. Next slide, please. So our journey did begin with the development of a steering committee. We definitely wanted to make sure that we had the support of our executive leadership and obviously members from multiple areas within the organization, ranging from security, environmental services to clinicians. We also wanted to make sure that we had the representation from our frontline staff as well. So again, our team ranged from members from infection control, social work, frontline clinicians, and legal. We just wanted to make sure we expressed how dynamic the team is and the perspectives that we had as we begin this journey. Next slide, please. So after looking at our data, we decided on 5 specific focus areas: overexertion, slips, trips, and falls, blood and body fluid exposures, workplace violence, and sharps injuries. The overexertion is defined as an acute or a chronic musculoskeletal injury that results from lifting or moving, typing or texting, twisting and turning. I just wanted to give a little context to that one because sometimes people are not exactly familiar with just the term overexertion. The slips, trips, and falls are exactly what they say they are, and then blood and body fluid exposures are speak for themselves as well. Next slide, please.
And one of the neat things about this project is kind of the way we went about it. At many hospitals, the employee safety work is driven by just occupational health, or there's like the one person that is in charge of it. But what we decided to do was apply the same quality improvement and patient safety tools that we use for our patient harm reduction and patient safety work to this problem of decreasing our employees' injuries and creating a safe work environment at Children's National. So we used the model for improvement and developed this key driver diagram. And you can see that our SMART aim is to decrease days away, restricted, or transferred rate. And that's also called DART for short. It's a OSHA metric that all hospitals are required to report. And what it means is just the more severe injuries among staff that require missed work, so days away, restricted duties, like a lift restriction or something, or transferred to another unit. And so we wanted to decrease our DART rate from a baseline of 1.48. We wanted to decrease that by 20% by December 31st of last year and sustain it for 1 year. So we met with teams and we used model for improvement methodology, and we came up with several key drivers. So we knew we needed a robust program structure, reliable data analytics, organizational awareness, and then employee safety equipment in order to be successful. So I'm not going to read all the interventions here, but this just gives you an idea of how we got this work started and how we made it sustainable. Next slide, please. This is just a timeline overview of our journey, and it really did start with the steering committee. We were so lucky to have really strong leadership support for this project, and I don't think we would have been as successful without it. So it really was leadership driven, and then, with an equal partnership from frontline staff. And so in 2017, we joined one of the work projects with an organization called Solution for Patient Safety, which is a network of 140 children's hospitals across the country and Canada, all focused on eliminating and reducing harm in children's hospitals. So Solutions for Patient Safety started a project to reduce overexertion injuries, and we joined up with that project at the same time as we got this work started. So that worked out really nicely. We also collected a bunch of baseline data on employee injuries. We created our dashboard, which is how we display our injuries, and we are able to track our data over time. That's one way we do that. In 2018, we did a lot of rounding, and we really tried to get the word out. We did a campaign called Your Safety Matters Too, and we took it to lots of places. I'll talk more about that in a few minutes. In 2019, we worked on spreading from pilot units to more areas. Raven mentioned we're a huge hospital, and we have locations in Virginia and Maryland and DC, and so we tried to hit as many areas as we could. We also purchased some new equipment, as you saw in our key drivers. It's really important. And then we expanded our dashboard to make that real time. This year and moving forward, we're doing deeper dives now into our events, which is kind of a neat method. And then we're developing new targeted interventions. Next slide, please. This is an example of our employee staff safety dashboard. And it may be a little bit confusing, so I'm going to orient you. On the left side, we've got all of the different types of harm. So we've got DART count, that's our days away, restricted, or transferred. And those are just whole numbers where we would put each month in one of those boxes, like September of 2019. If we had 4 injuries with days away, restricted, or transferred, there would be a 4 in that box. We also have a rate, so there's the DART rate is calculated with a numerator and denominator. I'm not going to get into that. Same thing for the TRIR, or the TRIR, which is total recordable incident rate, another OSHA metric of employee injuries. And then you see those same 5 focus groups under that. So in those boxes, what this dashboard normally looks like it's full of numbers, and the numbers represent people and injuries. When we don't have any injuries, like let's say we don't have any overexertion injuries for August of 2020, that box would be green. So we want to see this whole dashboard as green. We're not there yet, but it really is a big driver for us to continue the work to get our green up and our injuries down. Next slide, please. So we talked a little bit about already how we've integrated employee and staff safety into our overall safety culture. So we have the steering committee, we have the 5 safety focus areas. We just reviewed the dashboard. Another thing that we've done is we've included employee and staff safety information and resources in our error prevention training, which we do to all new staff. They get like a half day of error prevention training. Then we recently did a refresher for all staff actually last year in those error prevention training techniques and included employee and staff safety. Also, many of you at many of your hospitals, I'm sure you have some sort of daily safety briefing. We also do at Children's National, and we've worked hard to include employee injuries and employee, risks for employee injuries in that daily safety briefing. So that is another way that it is now included in our overall safety culture. Next slide, please. So this is just an example of some of the materials. When we did Rounding to Influence, when we focused on Your Safety Matters Too, we would go weekly with the team leads for each of the projects to different areas, like I mentioned, around the hospital, both clinical and non-clinical. We would give out information about the employee and staff safety work. We talked a lot about how to report injuries. We use RL Solutions for our safety event reports, and so we encouraged everyone to report their injuries, because if we didn't know about them, we can't do anything to prevent them and track them. So we went to many satellite clinics and on-campus and off-campus sites and reviewed those resources. Staff were really excited about it because they were like, "Oh, you're doing something for us," like it was exciting for staff to see so much leadership and attention and resources being put into their safety. Next slide, please.
So from 2017 to now, we've gone through multiple PDSA cycles and multiple different interventions. So we just wanted to highlight a few here. So the 5 focus areas each have work groups that meet separately to focus on the interventions. And here are displayed some of those interventions. In the top right, you'll see staff with slider sheets, sort of working with staff to explain how to use those to turn and lift patients appropriately. That was an intervention that was part of our overexertion work. Below that, you'll see a mechanical lift with the staff member in it. This was part of training to make sure staff are aware of how to use the mechanical lifts. We wanted to make sure, obviously, that the right areas had the right equipment. That was part of the interventions or key driver diagram. Below that, in regards to our sharps or our exposure injuries, we established blood and body fluid kits to be distributed to each area within the organization to make sure that they had the right tools to be able to address that issue. It also included a booklet about how to report and the steps to take to make sure that our staff are kept safe. For our needle stick prevention, we collaborated with our child life specialist who gave training on how to properly hold children to make sure we're preventing needle stick injuries. For our slips, trips, and falls, we made sure to incorporate more wet floor signs and encourage actually staff as well as families to make sure they pull out those signs when they see them if they see wet floors or a spill. And then also in the middle, you'll see our Safe Patient Lift and Transfer card. This was what we use as part of our bundle rollout to explain the steps to take to make sure that we're lifting and moving patients appropriately. We also work with security and our psych team to make sure that we incorporated these Kevlar sleeves as part of the workplace violence initiative. So again, this just highlights a few of the things that we've worked on in order to reduce injury over the years. There's so many and not enough space and time to talk about them all, but we definitely wanted to highlight some of the work that our teams have been working on, especially with input from our frontline staff. Next slide, please. This is one of our larger events. So the overexertion team is led by Alicia and myself, and so that initiative is pretty close to us. So in February of this year, we had a Safe Lift Fair before COVID. We worked with 4 vendors to come into the organization to demonstrate the proper use of the different equipment to safely handle and move patients. That included mechanical lifts, slider sheets, repositioners. We had over 70 staff attend. You'll see Aaliyah there smiling brightly with Dr. Bear in the sling. This is part of the Safe Lift Fair, where those that were still working on the floors, we went around to raise awareness about the use of the mechanical lift and to also invite them down to the fair. So this is one of our sort of outreach projects that really got people involved regarding the overexertion work. Next slide, please.
All right, and these are our results. This is our DART rate. So again, days away, restricted or transferred, going back to July of 2015 through July of 2020. You can see we've had a 33% decrease. We had a center line shift down in the desired direction. So we exceeded our goal, which if you remember from the key driver diagram, our SMART aim, we were hoping for a 20% decrease from that 1.48. Oh, excuse me. And we got it down to 0.99. So you'll also notice on the right side, there's some special cause points up there for those of you that speak the language of control charts. You can see it says COVID-19, where we had a spike in our DART cases, DART injuries. And then when we instituted universal masking, COVID universal precautions, then our rates dropped back down. You can go ahead to the next slide, please. So just to go a little bit deeper into some data, so we also look at every fiscal year, year over year. And so more recently, from fiscal year 2019 to fiscal year 2020, we had a 32% decrease in exposures and a 20% decrease in our overexertion injuries, and a 3% decrease in our sharps injuries. And it's been interesting to look at this data, like for each of the focus areas plus overall year over year, because the journey, it's not linear, as many of you know. It really never is in quality improvement and patient safety. So it's like 2 steps forward, 1 step back. We were doing so great with falls. We had like stepwise improvements. And then like this past year, we had, some upticks in falls. So, it hasn't been just like totally awesome linear progress year over year. We've had some bumps in the road. We really struggle with our violence. We often find that we have like a few patients causing multiple injuries or events that we count, multiple times. And so that has been a continual challenge. But these are 3 of our successes that we're really proud of over this last year. The work has been and continues to be really tremendous. You can go to the next slide, please. So a little bit more overexertion data. So this is the days between chart of our overexertion injuries with days away, restricted, and transferred. And you can see in the upper right that it's been over 128 days now since we've had a severe overexertion injury, which is fantastic. But yet we do average an overexertion with DART injury every 23 days, which is too frequent. So that is something we will continually be working on. Next slide, please. And then just to go even deeper, we have been focusing a lot on safe lift and transfer, so safe patient handling in our overexertion work. So we like to look at the injuries just from lifting and moving patients. And this is just year over year from fiscal year 17 to fiscal year 20. We had 4, then 5, then 2, then 3. And so, these numbers are real people. Like these are nurses just like me, myself, and Raven, who have gotten fairly severely injured from just doing their jobs. And so we take these injuries and we do a deep dive and try to do some cause analysis into why these occurred, and then create action plans to hopefully help them not happen again. Next slide, please.
So as we continue to advance our work, Aaliyah touched on it briefly. One of the things that we have incorporated into the steering committee is a rapid review. So this is a concept that we often use to review patient safety events, where we take a look at the problems and causes, go to those experts at the front line and get their input on why they think this happened, and also their input on steps to take to prevent the situation from occurring again. So in the rapid review process, we look at the injury. We have frontline staff and managers from the specific area where an event may have occurred. And again, we go through those causes and try to come up with action plans. We wanted to make sure that we were not just looking at numbers and coming up with ideas ourselves, but we wanted the input from the areas where those issues were occurring. So we're going to continue with that process. We've been doing it for about three months now, I want to say, and we've gotten positive feedback. So we're hoping to continue that process. We also, with the rapid review, are looking to expand our steering committee. As we have different teams come and talk to us in the rapid review process, we're hoping that this will spark interest and encourage more people to be a part of our steering committee. And then lastly, of course, as we work through the impact of COVID, we are thinking about how to change our interventions to, I guess, address the COVID issue. One of our teams is focused on exposures and the effect that universal precautions has had on our compliance rate with PPE has changed. Like, it's a new world, it's a new process, and so we're still continuing to monitor the compliance with PPE, and we're seeing that there have been some decreases, and I think that's just based on the change in the process and then the new equipment that's required surrounding universal precautions. So these are the things that we are looking forward to as we work to advance our work. Next slide, please.
Any questions from anyone?
Yes.
Thank you guys so much. That was a great presentation. We do have time for questions, so anyone out there listening wants to type a question into the question box, we're happy to address that. I want to say I am impressed and was kind of surprised by healthcare being the highest category of staff injury. I really never thought about it before, but being compared to some of those categories, I saw like mine accidents was way down on the list, and I guess self-perception there, I didn't even think about healthcare being high on that list. So that was impressive to me. I also think y'all did
that non-fatal injuries, obviously. I just want to make sure that to give context to the data. I'm sorry.
Right, true. Also want to recognize that you guys did a great job of recognizing and quickly compensating for the COVID impact on your workforce safety. So it speaks volumes to that you guys are managing this real time and addressing your staff needs. So great work there. And I'm sure any of the listeners would love to hear any kind of tips about that, and maybe go into just a minute or two about how things that you all have changed, or maybe what universal precautions or things that have developed as a result of COVID.
So I'll say one thing, not necessarily an intervention just yet, but we have changed the way that we actually audit. Before, we didn't separate patient-facing roles versus non-patient-facing roles. So now we're taking a deeper dive and looking at and auditing differently, because we have staff that are not required to interact with patients, so their PPE requirement is different. So we are separating out and looking at the data a bit different to learn how to properly address those specific areas with different criteria. So that's just one way in which we're just changing our perspective.
Right, so it's kind of a category of its own now, if you will.
Exactly.
Yeah. So there is one question in the box that said, great job. Can you share your rounding tools and the 5 safety focus areas and what you are viewing with your staff orientation?
Sure, absolutely. Yeah, we could probably do that best by email. So feel free to email us directly, or, Christy can help us get connected. But yeah, we can definitely share the rounding tools, and some of the information that we added to our error prevention. Yeah, absolutely.
Okay, yeah. If you guys email me that, I'll share it with the group.
Okay, yeah, no problem. Other questions?
No other questions currently in the box, but I do want to take a minute just to thank you again, both for the excellent informative presentation, taking time out of your busy schedule to share successful strategies that are reducing employee harm. So many thanks for that. A reminder to the group, our next webinar in the series will be Wednesday, October 21st. And just a reminder, brief feedback survey will be launched at the completion of the webinar. And if you'd like the slides, they're in the handout section on the control panel. So if there are no other questions, I'll say thank you again and conclude. Ask everyone to stay safe and healthy, and hope you'll join us next month. Thank you.
Thank you all so much.
Thank you.
Pleasure to be here.